Hi, this is Dr. Siddharth Gautam, and today let's talk about one of the most fascinating observations in the field of neurosurgery as to why some brain tumors cause symptoms very early while others remain silent for years. And the reason is not only the size of the tumor, it is mainly the location. So, what needs to be understood is that the brain itself does not feel any pain, but the structures around it, that's the nerves, the coverings, the pathways, they do. So a small tumor pressing upon the critical pathway can produce major symptoms very early, whereas a larger tumor in a relatively silent region may go unnoticed for a long time. For example, a tiny lesion in the motor cortex may cause early weakness in the hand, face, or the leg, but a bigger tumor in the frontal lobe, for example, may initially cause only subtle personality or behavioral changes, which people often tend to ignore or mistake it for stress or mood changes. Another important factor is the growth rate of the tumor. Fast-growing tumors tend to expand quickly. The brain doesn't really get time to adapt, so the symptoms appear early. Slow-growing tumors expand gradually, and hence the brain compensates for the raised intracranial pressure, which delays the symptoms even when the tumor is large. So one has to remember that with the brain tumors, early symptoms are not always linked to the size. They are also linked to where the tumor is and how fast it grows. Stay tuned to Neurosurgery Connect to know more about this.